Hi, I'm Dr. Calantoni, and I want to share with you a little about what your first visit will be about in our office and whether you have neck pain, back pain, daily aches and pains, possibly you have some pain that's referring into an arm or the leg. You may have some pins, needles, numbness, tingling, or in your feet or in your hands. Maybe you injured yourself lifting something, or you fell, or you may have been involved in a motor vehicle accident. Uh, the first thing we're going to do is do an initial intake, and it's where you have to fill out paperwork. And we're going to ask you a series of questions in that paperwork. It takes about 10 to 20 minutes. And at that point, then I'm going to take that paperwork and I'm going to look at it, and we're going to bring you back for a physical examination. Physical examination, we're looking for neurologic testing, muscle testing, um, reflex testing, and dermatomal sensation testing. So basically, those are the subcategories of the neurologic testing: the muscle, the dermatomal sensation, and the reflexes. And the reason why we do this is because we want to correlate our physical examination findings with the symptoms that you're experiencing. We're also going to do a range of some orthopedic tests. The orthopedic tests, the goal is, the reason why we do those is we stress the joint in a certain direction to get a better understanding of which side is affected and where the lesion is. We call, if there's a disruption of ligaments in the spine, or if it's in an extremity, that's actually termed as a lesion within the body. So after we get these findings, we're going to ask you a series of questions. And at that point, we are going to, if at that point we determine that an immediate MRI is medically necessary and indicated, obviously we're going to refer you for the MRI. We may proceed now with some gentle modalities just to decrease some of the inflammation, which will increase some of the pain. But we won't do any type of aggressive modalities because obviously we don't want to aggravate the condition. So we can proceed with caution, even if we do have red flags in our examination that would necessitate the need for an immediate MRI. And once you get the MRI, we like to have you bring the disc in. So we sit knee to knee and review the MRI findings, and we show you exactly where the disc is. And on the MRI, the two types of images, you're going to have a sagittal image that's like from the side, and then you're going to have an axial image that's directly from the top. So it looks sort of like this, the side view, and then you're going to have a top view. It's sort of like taking the celery stick, cutting the top, and looking straight down on it. So we like to review those findings with our patients so you have a good understanding of the degree and the extent of the space occupying lesion that may be putting pressure on neurologic elements. We're looking for that disc herniation to be putting or even a bulge to be putting pressure on either the spinal cord or the exiting nerve roots. And this will give us a detailed blueprint of exactly what's going on from a soft tissue standpoint. We may order X-ray. X-ray, we order them standing, flexion, extension. So we do intersegmental motion analysis where we're looking for intersegmental motion patterns. We're looking for, well, you have 24 movable segments in your spine. In your neck, you have 7. In your lower back, you got 5. So if we're doing a flexion extension of the neck, we're looking at the 7 intervertebral discs and vertebrae, and we're looking to see what the vertebrae are doing, if they're moving in big blocks. If they are moving in blocks, you're looking for the segments above and below the block to see if there's hypermobility. So we know how to apply our treatment, and we know what type of stabilization techniques we need to apply to help restore homeostasis to the spine. If the MRI or the X-ray is needed, we will let you know and give you our professional opinion on that. When it comes to modalities, the type of modalities that we utilize are spinal decompression traction therapy. This is where you lay on a state-of-the-art machine that is FDA approved. You lay on your back. We tie a harness around your waist. That's tied. Then we tie a rope to that harness, and that rope is tied into a computer, and we calculate the load, the negative load or the axial load we calculate that load to your body weight. So we're applying the right load. Obviously, we don't want to start you off sprinting on a machine like that because it might irritate the lower back. We want to start you off on a crawl speed. So it's a very gentle stretch. And we get great results with this machine. Another machine that we utilize is high power hot water Euflorage massage table. It's a state-of-the-art table made by Aquamed, where you're laying on your back and you have a Euflorage high pressure water that's going up and down your back. It's a dry hydrotherapy machine, so you're not getting wet. And we have you do certain stretches to open up different areas of your back while this water is massaging that area. A lot of times when you have compensation, one side of your back will be in spasm, and then the other side will be overextended. So obviously, we want to massage the area of the spasm to release that spasm. So we have you do certain stretches with your legs or your shoulders, depending on what your complaints are. Another modality that we utilize is intersegmental traction. This is where you're laying on your back. And there's a roller that pumps up and down your back. And what this does basically is unloads a lot of the positive. Well, so I can explain to you a little about the positive pressure with spinal biomechanical engineering. To understand a little more about the spine, anything mechanical has two types of loads: compressive and tensile. Anything on the compressive side, you're going to have positive charge, and on the tension side, you're going to have negative charge. Just like any kind of mechanical device. So where the positive charge is, that's energy, and where the negative charge where the negative charge is, that's you're not going to have energy build up in that area. It's all going to be on the side of the positive. And in the spine, the positive charge builds, and eventually it has to combust. In a vehicle, for example, the transmission will cease, but in your spine, the combustion is in the form of injury. So you're going to blow a disc out, tear a ligament, tear a muscle. So what we want to do is unload the positive charge. And how we unload the positive charge is very simple. We apply a tensile load in that area to put a negative charge there, and the negative charge cancels out the positive charge, and that releases the pressure and reduces the muscle spasm, increases the range of motion, decreases the inflammation, and obviously at that point, hence decreases the pain. So it helps. So obviously with a lot of the modalities that we use, we're not fixing problems here, because a lot of these pathologies are permanent problems, and you're going to be dealing with them for the rest of your life. But we're working with the focal point of the problem to increase the tensile capability and the elasticity of the area. So this will help reduce future injury of the same area over and over again. So we utilize the intersegmental traction where you're laying on your back. All the repetitive activities of daily living that we do every day have a lot of forward compression. Texting, sitting at a computer, driving, sitting on a couch, eating. We're always compressing the front of our spines, and what this leads to is forward head carriage. The head weighs approximately 8 to 10 pounds. For every inch that the head is translated forward, it doubles the weight of the head. So basically, if your head is translated an inch forward and your head weighs about 10 pounds, on average 8 to 10, it's double the weight that these muscles up here have to carry. So that's why we see a lot of tightness in these muscles a lot of times. So what this machine helps do is it helps bring your posture back and bring the head back, unloads a lot of the pressure in the spine, takes away a lot of the muscle spasm in this area, and gets your mid back, your shoulders, and your neck feeling a little better. And at the same time, a lot of times this helps with headaches. So we utilize intersegmental traction. We utilize cold laser therapy. Cold laser therapy just basically is a state-of-the-art low-level laser that you feel a little bit of warmth, but it emits photons into the area. The photons interact with the chromophore of the cell. That's what metabolizes the cells. So it basically initiates or makes the cell proliferation more rapid. So it helps heal damaged and injured cells, and it also helps regenerate the cells. So we utilize cold laser, also very effective for decreasing the inflammation in the area. If there's an acute trauma, the cold laser is very effective. We also utilize therapeutic ultrasound. Therapeutic ultrasound sends a deep kinetic warmth into the tissues or the muscles that you're working on, and what that does is it helps flush out those pro-inflammatory exudates in that area. Whenever you have an injury, basically what happens is you tear the ligament that's involved in that articulation or in that joint, and when you tear that ligament, there's a pro-inflammatory response that takes place. And the pro-inflammatory exudates that are secreted are bradykinin, prostaglandins, and upregulation of cytokines. And when these are released, they act as irritants in that area, and then the nerves, the free nerve endings in that area, elicit that response and fire a nociceptive response to the brain and say there's a problem, and that's what alarms you. Medicine uses something to block that signal to the brain. But what we want to do is flush those pro-inflammatory exudates out of the tissue, and that's what the therapeutic ultrasound is very effective at doing, because it increases circulation all the way down to a cellular level. So we want to flush those pro-inflammatory exudates out into the bloodstream. So that initiates some intercapillary exchange of new blood flow nutrients back into the air. You get some oxygen and calcium pumping in there. And obviously it helps kick in the healing properties of the area. So and then also along with the therapeutic ultrasound, the cold laser, we also utilize interferential muscle stim. You may have heard of TENS, but interferential muscle stim is what the professional teams are using. Much more effective than TENS. A little different. It's I like this called TENS a dinosaur at this point, but IFC is basically mainstream now. So that's what we utilize when it comes to EMS, electrical muscle stim. And then when it comes to the adjusting techniques, we use hands-on adjusting. The latest forms of hands-on adjusting, chiropractic, biophysics, spinal biomechanical engineering. The techniques have been very modified and they're very safe. Adjusting techniques are very safe. Some people are very scared of the adjusting of the spine. So to accommodate those patients, we have a state-of-the-art instrument adjusting tool, which basically applies an impulse. It's a repetitive impulse into the spine. It's been researched and documented in index peer-reviewed literature in neurophysiologic journals. This instrument in the impulse basically that it applies into the spine. When the spine oscillates, it oscillates anywhere between 4 and 12 hertz. Well, the instrument has an accelerometer built into it, so it senses what the spine is doing in real time, and it processes it to a computer chip, and it oscillates at the same resonant frequency of the spine in multiple thrusts, and it actually changes speed. A good example is when you push somebody on a swing, you want to push them in rhythm. So the instrument can sense the rhythm of the spine when it's oscillating. And then eventually you're going to get to a point where you're pushing somebody where you're not going to be able to push them any higher. So, but what will happen possibly if that swing, if the bearings are rusty, maybe that swing's not going to swing high. You know, it's going to go, you're going to go slower maybe, or you're going to go faster. Well, the instrument senses if you're freeing up or if you're tightening up. So it'll either go slower or faster. When it reaches that maximum point of mobility, it stops, it beeps. It gives us a double beep if it's arrhythmic, the area. So very, very effective tool. So we also utilize this for adjusting. So hopefully this gave you a good rundown of what your visit will be like. If you'd like to give us a call, you can reach us at 215-743-5330.